Hello again, colleagues, and welcome to the next episode of DINCast, where I'm delighted to be joined by Professor Colin Talbot from Manchester University to talk all about the implications for government and public services during the current crisis, and in more particularly, what comes next. Colin, would you just mind introducing yourself to the viewers? Tell us a little bit about yourself.
Yeah, sure. I'm a bit of an unconventional academic in that I didn't come into academia until about 30 years ago, about halfway through my working life. I actually, ironically, started my working life as a lab technician in pharmaceuticals research for ICI at Alderley Edge, where they're now setting up one of the big COVID testing laboratories. And I've had quite a varied career before that, including working in local government and British Telecom. So I've got some practical experience before I became an academic. But for the last 30 years, I've been knocking around governments in the UK and abroad, giving them advice, researching what they're doing, testing whether or not what they say they're doing is actually working, and generally making a nuisance of myself.
Well, hopefully we can delve a bit. You give us a bit of insight as to what you think might come from this, because as you mentioned, I mean, you've been doing this for 30 years. You've advised, you've challenged, you've researched sort of government. What's your position about the current situation within the country from a government perspective? What are we getting right? What concerns have you got?
Well, first of all, I mean, obviously the totality of the present situation is unprecedented. The only thing that comes close in terms of the overall shock to society is world wars. Even the 1920s recession, Great Recession, Depression wasn't as bad as this in terms of the effects that it's likely to have. But having said that, I think the individual components of what's happening, if you start to break the problem down, are actually not particularly unprecedented. And there's a lot of things that we have had experience in a number of different situations before of having to deal with. And I think that's the first thing to say. So it's not overwhelming. It can be dealt with. The second issue for me is, from the government's point of view, is that there's been very little clarity on what the purpose of what they're doing is. I mean, obviously they want to save lives, save the NHS, all that sort of stuff. But what's not clear is what they're trying to do in terms of coping with the epidemic. Other governments have been very, very clear that they think you can suppress the epidemic and stop it spreading. And they've gone hard and fast to try and do that, like Singapore, like New Zealand, number of other countries like Germany, where they've pushed down very, very hard on trying to suppress it. I think our government has vacillated about that, about whether or not they think the thing can be suppressed at all. The chatter about herd immunity at the beginning was very disconcerting, especially for people like me who've got underlying conditions, because I was going to be one of the victims of herd immunity if it happened. And I just think they've been very, very unclear all along about the purpose. What are they trying to do? Are they trying to stop the spread, flatten the curve, as they keep saying? Do they see it as inevitable that 60 or 70% of the population are going to get the virus? It's been very, very unclear, and still is unclear in my view.
Do you think that the systems and the way that we sort of work across public services has helped or hindered our response to the COVID crisis?
Well, on the National Health Service, first of all, I think we have to remember that for 30 years, successive governments have broken the National Health Service up into component units and set up all sorts of strange relationships between them. And I think it's a bit of a misconception that we have this single unified command and control system within the NHS, and I think some of the problems that have been occurring is because of some of the institutional barriers that have been put in place between different components of the NHS. But the other big problem, I think, is that the default reaction of British central government whenever it's faced with a big crisis, and you can see it most extremely during the two world wars, is to centralise everything, is to put everything under Whitehall's control. This epidemic inside the UK is both national and global, but it's also local. There are areas of the country where they've had very few infections, where some of the lockdown measures that we've put in place right across the country probably aren't appropriate. They don't need to do as much as they're doing at the moment. There are other parts of the country, like London, where possibly the lockdown should have been even tighter than it's been, and should be more like some of the other countries have done in terms of really restricting movements. I mean, our eldest son lives in Paris, and they're not allowed out of the house without a piece of paper to show where they're going. So I think it's been a very centralised reaction. You can see some of the mistakes that have been made because of that. I mean, we had the great fanfare about opening the XL Nightingale Hospital in London, 4,000 beds. Last weekend, they had 19 patients in there. They've now developed these huge testing facilities when we had 50 or 60 testing facilities already. The one at Milton Keynes, they're working 4-hour shifts because they don't have enough work to do. They've got it up and running. They've recruited staff from all over the place, but it's not working properly. And it was this attempt to centralise everything, which for some things is important. So things like the supply chains certainly needed central government intervention. The legal powers needed central government intervention, but a lot of the organisation on the ground is local, and it should have been local government and other local institutions playing a much greater role in orchestrating how things happened on the ground. And, you know, just one final example, you know, they set up this website to recruit people for the National Health Service to help the NHS. They got 750,000 names on it. And as one wag said, there's some poor civil servant somewhere in Whitehall scratching their heads and saying, what the hell do I do with all of these? You know, how do I distribute these names? How are we going to use them? Are there people out there at local level who can actually take this and turn it into something useful? They did all of that without, as far as I can see, talking to local government at all, or to local NHS people about how you would use something like that.
It's often referred to as this is unprecedented. We've got no reference points for you know, any of the things that are coming through. We live in a very different time to the sort of the Spanish flu era and that. So leaders and governments are having to take decisions at speed, and I think we probably both accept that actually that's really quite challenging, and quite often some of these decisions aren't going to be the right ones. Do you think there's anything, you know, from a public sector point of view that we could do to improve the way that we make decisions in these sort of situations?
Yeah, I mean, I think one of the problems, again, and it's a common problem in British government, is keeping stuff internal, groupthink, very small groups of people making all the decisions. There's a fabulous book by Anthony King and Ivor Crew, this thing called The Blunders of Our Governments, and they go through a dozen cases over the last 30 years where governments have made really serious policy mistakes. And in every single one of them, one of the fundamental errors has been not having open, deliberative policy making. I mean, yes, you still have to do some things at speed in a situation like this, but that doesn't mean it shouldn't be open to challenge and discussion. And I think there's every sign and symptom that some of the decisions that have been made, some of the bad decisions that have been made in reaction to COVID are the result of things not being open to challenge and not being discussed properly before they went ahead. I mean, for example, just take one example, why did we abandon community testing, tracking and tracing and isolating, where we're now having to bring it back, but there was never any clear justification as to why we stopped it in the first place. And they simply wouldn't discuss why they'd stopped it, where every expert that I've spoken to was saying it was absolutely essential. And there was guidance out there from the WHO and others saying that's what should have been being done.
One of your published works, Colin, is around innovation in government, and you've looked at this sort of in depth in that. You know, from my perspective, from the Disruptive Innovators Network perspective, is I would have thought this is a really good time to make sure you capture this learning and learn what you can innovate with. What's your thoughts around that?
Yeah, I mean, I think in normal times, I've always worked on the basis that you have to strike a balance in public services. There are certain aspects of public services where the public will not tolerate them failing. So you cannot be as innovative or as disruptive in some services as you would in the private sector, for example. where if a company goes bust, it's unfortunate. Something else comes along and takes its place. If a tax office goes bust, or a prison collapses, or a hospital stops functioning, people get very, very upset about it. So there's always a balance. And I think in normal times, my sort of rule of thumb has been that you should innovate in parts of the system to start with, see what works and what doesn't, and then try and systematize it through the entire network if that's possible. There's always issues about that. There's lots of examples where you've innovated with something and it works incredibly well in a pilot project, but then you find it very difficult to roll it out into the whole system. But I think in a lot of public services, that's what you have to do. Excuse me. I do think, though, some of the ways of working within big organisations are going to change dramatically because of this crisis. What we're doing right now, video conferencing, which has been around for a long time. I've been using it for 15, nearly 20 years, but it's very difficult to get colleagues to do it. I've had an uphill struggle in universities trying to get people to use these sorts of systems for years, and suddenly everybody's doing it. And I don't think we'll go back to not doing it. Maybe we won't do quite as much of it, but I do think a lot of these changes are going to come and stick, and that'll include things like in health, telediagnosis, talking to patients online rather than people having to troop into, I've got a lung condition, which means I'm susceptible to infections. I dread going to the GPs because it's full of people coughing and spluttering. I'd much rather do it by email or talk to the GP like this. And I think some of those changes are going to come in now.
And so are you more or less optimistic about the potential future of work, to use this situation or work with this situation we're in to actually do things differently? Do you see more opportunities than downsides?
I think both. I mean, I think my fear is that what's happened in the past when we've had crises, the British state centralised things, and then when the crisis is over, they stay centralised and they don't go back to where they should have been. I think there's huge opportunities for local initiatives around this. One of the things I've been quite stunned by is the level of self-organisation in response to it, particularly early on in the crisis, when people like me were being asked to self-isolate, or people who had symptoms were being asked to self-isolate. This is before the lockdown started. And they were having difficulty getting food and medicine. And I mean, just in our little area here, the local church people took the initiative, but there were several networks set up, and even on our individual estates here, people were talking to each other on WhatsApp and Facebook and organising food and medicine collections for people on the estates that couldn't go out and so on. And that was all being done completely spontaneously. So, and I don't, again, it'll the wave will recede like the tide always does, but it'll leave behind, I think, some innovations which will stay after this crisis is over.
I mean, one of the things that the government tried to do very, very quickly was sort of, I suppose, its financial support packages and, keeping people in work and all of these things that we're able to do very, very quickly, which is, you've got to give them credit for around that. But as my viewers and leaders will be looking at this, is be thinking, well, actually, at some point, there's going to be sort of a price to pay around that. We've seen the OBR and the IFS reports about the level of debt that will go up and the impact on GDP. What's your take on what we can expect or what might be to come around some of the financial and fiscal issues that the government will have to tackle?
Yeah, I'd go back a little bit to, they've made lots of good announcements. They've talked the talk. The experience of people on the ground is they haven't yet walked the walk in terms of getting the money actually out to people. Delivery has been incredibly slow. One of the people I talked to in Canada, who's an ex-senior civil servant, on the YouTube for people to look at, he explained that within a week of them announcing the financial packages, people were getting checks for people who'd been furloughed or laid off work. And that was on a system, he pointed out, which was still running on COBOL. It was so old, but they were processing a year's worth of claims in a matter of weeks. incredibly successful. I think we've been very bad at that. In terms of the long-term financial implications, again, I think there are models we could use for this. I mean, after the Second World War, when we had to do Lend-Lease with the Americans to buy equipment in order to fight the Second World War, we set up long-term bonds. We only finished paying them off, most people don't know this, in 2003. So I think there are long-term financial arrangements when you've had something like this happen, which is quite possible to put in place, which then wouldn't affect the sort of ongoing day-to-day finances of government, particularly where you set up long-term bonds and they can be guaranteed by the Bank of England and all sorts of other, there's all sorts of devices for ways of doing it, which will massively ease the pressure on public finances going forward.
So as we move out of what's to be termed sort of survival mode, what do you think comes next for the role of central, local government and public services in general? You know, does this present sort of an opportunity to drive through new relationships or engagement with citizens?
Well, I hope it would. I'm not entirely convinced it will, but I think we ought to be rethinking how we deliver public services and some of the accidents of history about what sort of public service structures we have. I'll tell you one small example, comparison between the UK and Denmark. In the UK, we just accept that we have a central tax authority, HMRC, that we all have to get our tax paid through. And we have one big benefits agency, the DWP and Job Centres Plus, that deals with all of that. In Denmark, all of that, although the policies are set centrally, all of that work is conducted by local government. They collect all national income taxes. They distribute all national benefits. They've got a massively decentralized system. It allows them to experiment, which means you can have different local authorities try out different ways of doing those particular jobs, and then they can generalize across the local authorities with the ones that work. A bit like happened here in the 1980s when we introduced housing benefit, where local authorities could do it any way they wanted. And there was an awful lot of innovation. I worked on one of the housing benefit projects for Lambeth at the time. There was lots of innovation. Some of it didn't work, but it wasn't a massive problem because it was one local authority where it didn't work. It wasn't the entire country not working. And we've seen what happens when they try and do systems change for a big system like that. You know, 9 years on from the announcement of universal credit, they're still trying to implement it because they did a one-size-fits-all for the whole country, and it simply didn't work. So we ought to be able to rebalance and have more innovative systems which allow for innovation at local level in the future. Whether or not it'll happen out of this crisis, I don't know. I'm not, I have to say, terribly optimistic, because as I say, the history teaches us that what happens is things get centralised and they stay centralised rather than the other way around.
And are you concerned that some of the notices that have sort of been introduced will remain? I mean, we've talked about sort of, you know, tracking diseases and things like that. There's an app being developed for contact tracing and things like that. Would you be concerned from a sort of a civil liberties point of view, as some of this centralisation could get something in that they couldn't have achieved without it?
That's entirely possible, and interestingly, some of the people in the intelligence community are very concerned about that. Actually, surprisingly, I've done a lot of work with people in the intelligence communities over the years, and you'd be surprised the number of them who are strong civil libertarians, actually, and are very aware that if they push things too far, they will undermine confidence in themselves as institutions. And they are warning that we have to be very careful with some of this stuff, like the contact tracing apps that are being introduced. I'm relatively reassured in that most of it's being done on a voluntary basis. So people are being asked to download the app for their own good and then delete it when this is over. And I think that's probably the right way to go. And it can be anonymized. And I'm talking to the CEO of a company in Denmark that's doing this work for the Danish government tomorrow morning at 10 o'clock, and that will be on my YouTube channel as well. And he's going to explain to us how they're doing it, and I suspect that's the sort of thing that they're doing from what I've read so far.
So final question, Colin, then is, you know, if there was one thought or one piece of advice or one insight that you would like to sort of share with my members around where we are now or what they've got to look forward to, what would you share with them?
I would say, remember trying to keep a sense of balance and proportion in all of this. Yes, it's a huge crisis. Yes, it's at an unprecedented scale in terms of problems. But if you break it down into individual components and think about the long term and what we want to retain out of all of this, as well as innovate, then that's a better way of thinking about it and thinking about what we can and can't change as a result of this. I always think it's a question of balance in these things. We need to both conserve some aspects of public services around, bureaucracy actually has some good things about it in terms of guaranteeing regularity, and we don't want to lose that. At the same time as we don't want to remove some of the flexibilities that have been introduced into the system. One of my colleagues from Australia, for example, yesterday when I interviewed them, was saying one of the problems for social services where we've introduced these individualized components into social services, they don't work very easily in a crisis situation like this, and it makes it much more difficult, because if you've got an individual care package and for example, in Australia, people hire the staff who work for them using their individual care package. How do they pay them when things go wrong in a situation like this? How do they ensure that those people have got PPE? A whole range of issues come up around those. And the worry is that some of those systems will disappear in the flurry to try and make things work temporarily, and then they'll be gone, will be set back a decade or so. So it's always, I think, about trying to keep a balance, trying to realise what it is we want to conserve, what it is we can change, and what we should change for the future. And certainly for the key message for me would be that we need to think much more locally about how we organise services all right across public services. At the tail end of the last Labour government, there was a really interesting initiative called Total Place, and some of your members will remember it. And then it died when the Labour government, changed. And I think we ought to be getting back to some of that stuff and thinking about how we organise things and coordinate things better at a local level and do things locally that need to be done locally, and not simply push them up to the national level.
Probably a really good point to finish on there, Colin. I mean, that's exactly what my members in the social housing space seek to do. So thank you so much for your time.